Hi, my name is Joe Estes. I'm a student physical therapist, and I'm here to talk about a dependent transfer using a vertical lift between a hospital bed and a wheelchair bed. Now, it is going to be important to talk about why we use these lifts before we talk about the lift itself. So, National Institute for Occupational Safety and Health talks about the maximum amount of weight for a patient to be transferred effectively and safely is about 35 pounds. This is not only going to be important for patient health, but also for therapist health, because us as therapists, we're not able to help patients if we are patients themselves. Talking more about the lift, communication is going to be extremely key for a smooth transfer. Now, keeping the patient informed on what's happening, making sure they are safe and secure is going to be important for the smooth transfer of patient from a bed to the wheelchair. Now, talking about the lift itself, it's important to assess the environment first, make sure there's no obstacles in the way between bed and wheelchair. Make sure that the bed and the wheelchair are both locked before transferring the patient. And we'll go ahead and make sure that the handrails of the bed are lowered so we don't have to lift the patient higher than we need to. Next is going to be really assessing what kind of sling we need. A larger patient is going to need a larger sling, so that's going to be important for assessing what we need for each patient and the safety of that transfer. Once we have the sling we picked out and the environment clear, we're going to go ahead and have the patient sit up if they can, put the sling behind their back, smooth that out, and we'll drape it down towards their legs, have the legs of the sling underneath the patient's legs, and then cross those at the bottom for safety and comfort of the patient. Next, we'll bring the lift in, position the boom over the patient, and we'll have the sling loops fastened to the boom of the lift. At this point, we'll go ahead and have the patient hands onto the boom itself, make sure they're okay to start our transfer, and we'll go ahead and start lifting them up slowly. At this point, we want to make sure the back of the sling is positioned behind their head for not only comfort, but safety as well. During the lift, once we have the patient lifted up and we're ready to move, we will have one therapist or clinician holding the patient for support, and we'll have the other one moving the lift to our desired location, which will be a wheelchair. Once positioned over the wheelchair, we will instruct our patient that we're going to go ahead and continue lowering them slowly. If they're okay with that, we will start. Once they're lowered slowly into the wheelchair and sitting there secured, we will remove the loops of the sling and remove the lift from the patient. Before we walk away, we want to have them sitting all the way back into the wheelchair and leave them a call bell in order for them to call if they need any help. The main thing is we want to make sure they're safe, secure, and understand what's going on between each lift at all times.